Yes, or they're in a car as unborn babies. They walk with their mother. They're always on the move. In fact, pregnant mothers often notice their unborn babies become somewhat unsettled when mum just lies down for a rest or goes trying to go to sleep, and that's when the baby starts moving. They love movement. So this is our boy Alexander with his dog Vito, settling his Vito baby dog by movement. Vito was named after Don Vito Corleone, from The Godfather. So there's movement again. So this is an ideal movement in which mum and baby are almost attached with a sling, and there's skin contact as well. A pram ride, especially a rough pram ride. Not too smooth, so over bumps. Okay, if it's too smooth, the baby doesn't settle as much as if it's a rough one. Over bumps, over cracks in the footpath. They like sort of rough movements. And the same in a stroller, not too smooth. So we've gone through swaddling, we've gone through movement, and now we'll go through sounds. I don't want to put in an ad, but I have. And the key features of sounds for silence are that they are low pitched. We've designed them so all the sounds are below 500 hertz. Very rumbling, low, because that's what babies hear in the womb. They're continuous because babies do hear continuous sound without gaps. They do not have gaps. And it's high volume. It needs to be high volume. Why? Because when a baby's crying at 110 decibels, you need to have something louder than that for the baby to actually hear it and be distracted. 110 decibels is very loud. In fact, 110 decibels is, if you're continually exposed to 110 decibels ourselves, it's bad for the human ear. It's like a motorbike, very loud. So we can settle them, but we do need to produce a sound which is slightly louder than their own crying. And as soon as they hear it, I mean, it's magic. We'll show it to you in a sec, actually. We'll show you a video of it. But as soon as they hear it, and it works in about 9 out of 10 babies, honestly, it's prospective studies we've done. They're not great, they're not double-blind, all that. But prospective randomised controlled studies, double-blind crossover, international, 3 arms. But the studies we've done show that these babies settle, 9 out of 10 babies settle, and 1 of 2 of those under 1 minute. It's quite impressive as how quickly they settle with sounds for silence, for that matter, with a dishwasher or a washing machine, but you can't keep it on for very long. It's a waste of electricity. So that's where Sounds for Silence came along. It's also come from a book I've written, really informative, reassuring, uplifting book about what's really normal variation, because parents become really concerned and anxious about what might be abnormal, such as a small fontanelle, a big fontanelle, or a head that's above the 75th centile, or thriving at the 25th centile but parallel to the 25th centile. So I go through all the variations of normal in the book, which I think is a good thing, because parents in Western society, in developed society, have a heightened level of anxiety. If you go to developed countries, there's no anxiety, there's just survival, and there's eating and hunger. But we have the luxury of becoming anxious, and we do a wonderful job. And we go over the top. A little anxiety is a good thing, but you get to the tipping point, and a lot of us get to that tipping point. We're over-anxious and we're dysfunctional. Now, this is an example of, this was a interview I did in Allentown. I have been up and down the east and west coast of America, and I'm probably going on Good Morning America in a couple of weeks before Mother's Day. So keep an eye. But this is a little interview I did in Allentown, which is the Billy Joel territory. And this baby is going to start crying in a moment, and we'll put on Sounds for Silence, and the baby will settle within seconds. And then when we turn off Sounds for Silence, the baby will start crying again. When we turn it back on, the baby just settles again. And it's quite a beautiful thing. Now we need sound. This is live. Perfect baby. Perfect baby. So that's just sound. It needs to be loud enough. And this happens all the time. I mean, we're not surprised by this. And I'm happy to go on TV shows anywhere and demonstrate it, because 9 out of 10 times it works beautifully. And the interviews surprise like this one. But they do work. It does work. And if it doesn't work, well, we don't show it to you. Now, there are other simple strategies. Now, again, all these strategies remind babies of the third trimester. So anything that I believe reminds them of those last 3 months of the pregnancy can be helpful. And the dummy is a substitute for the nipple. So nipple's probably best, but in Australia it's pretty difficult to walk around with a baby on the breast 24 hours a day. It just doesn't look that great. But it can be done. And it's done in Africa and other places. But if we can't do that, and mum needs to sleep and a rest, then we use a substitute for the nipple, and that is the dummy. And we're for dummies. I'm happy with dummies. And the difference between, tell you the difference between old parents and young parents. The young parents, most of you got kids? Yeah. You're mainly young parents. I'm an old parent, so I'll tell you the big difference between you guys and me, and that is the young parents have got dummies everywhere. So you walk into their house, you have dummies there, and dummies on the floor, and dummies on that shelf, and on the TV, and they're everywhere. Cupboards. So you look anywhere, and they've got dummies, and they know where to find them and put it in the baby's mouth. And, they're everywhere. There must be hundreds. And now, in my age, our kids are in their 20s now, they don't use dummies anymore. But now we've got, Alison and I have just got glasses everywhere. We're going to bifocals, multifocals. We've got about 50 or 100 glasses. We're going to find which one's the most appropriate. That's the big difference between young parents and old parents. Anyway, I do recommend, though, that dummies are only a nipple substitute, and babies love nipples and sucking. And when they're born, a lot of babies have already have got blisters on their wrists from sucking in utero. You see it, the blisters. So they like sucking. It's a natural instinct. But they stop. They grow out of that around about 4 to 6 months. And I think one of the cautions I suggest is that after 6 months, they don't really need the dummy to suck, and it becomes more of a security object. And it's not the greatest security object around, because you can see children at 3 years with one dummy in this hand, one dummy in that hand, and one in their mouth, and a few other dummies. And they're not the ideal security object. They fall out of the